Well, hello everyone. I'm Dr. David Ajibade, and I'm the co-host of today's webinar. I usually say tonight because that's when our webinars usually happen, but this is the afternoon, and our guests will be on with you shortly. And Sherry, my business partner and co-host, is going to be in the background working with them. That's her right there next to me. And I have to tell you, we are really excited about today's presentation because this is really, to us, the core, the foundation of who we are as human beings, and really the foundation of health and life has to do with spirituality. And it's been taking a while for us to really find good presenters who can help us and help guide people and explain these principles in a way that is not fringy, but is an intelligent, scientifically based approach. We've been looking for people who could help us do that. So we are really excited that Whole Person Resources is partnering with us and bringing this information to the world. And that's our philosophy in a nutshell. Health is a large word, and it combines the spirit, the mind, and the body. And if you were here last time when we had Dr. Koenig, who is the head of the Center for, I believe, the Center for Spirituality and Medicine at Duke University. Well, Dr. Koenig is a psychiatrist, and he gave an excellent presentation on this topic and showed us how everything works together when it comes to health, and even shows that long life, health, peace of mind, recovery from disease, all are a function of our spiritual and religious inclinations. And it was actually through him that we met our guests today. So we are really looking forward to this presentation. As I said, that's our goal over there, and that's to bring you the best, the absolute best, really, in information concerning health and strength and human effectiveness. And if you visit our websites, and all you need to do that is to click on the banner above my video, and you can go to our website and you can see our archives and upcoming webinars. We have quite a few coming up that will be of, I believe, interest to you. But today it's about Whole Person Resources, and let me just jump over to that really quickly. That's our disclaimer slides. We need to put that in. This is not about treating a disease, so please do not substitute anything for standard medical care without asking and consulting with your doctor. Let's see, are they ready? Let me just check to make sure everybody's here. Okay, good. Sherry says they are ready. All right, before I hand over to our guests today, I'm going to say a few things about them, and obviously you want to see what they look like, and you are going to see what they look like live in real time. But this is being hosted by Whole Person Resources, or this is being presented by Whole Person Resources. And Whole Person Resources is a committee of the hospital. Now, which hospital is that? It's actually Glendale Adventist Medical Center, which is a 520-bed regional center in Southern California in the LA County. Now, Whole Person Resources is a committee of the hospital that has accepted the responsibility, I like that has accepted the responsibility for helping physicians integrate spiritual care in the clinical environment. And boy, how we need that. Now, more about Whole Person Care or Whole Person Resources. They understand and they appreciate the need for a person to be spiritually, emotionally, and physically supported, and that each of these three aspects make an important contribution to the healing environment. And I tell you again, that is so important. I wish I had that in my medical practice as well. All right, the moderator for today's presentation is Bruce Nelson, and he is the Director of Chaplaincy Services at the Glendale Adventist Medical Center. Now, without much further ado, I'm just going to say, gentlemen, thank you so much for taking the time to do this, and I'll hand this over to Bruce right now. Let's see. Okay, they say they're ready. Okay, over to you.
Hello, welcome to our webinar today on integrating spiritual care into the clinical environment. We have a story to share with you, and I want to introduce to you the cast of characters involved in telling that story. With me is Dr. Jack Yu, Associate Director of Glendale Adventist Medical Center's Family Practice Residency Program. and also Associate Professor at Loma Linda University, USC, and UCLA. Additionally, we have Dr. Dennis De Leon, who is the Vice President of Medical Affairs at Glendale Adventist Medical Center and the Medical Director of Glendale Adventist Medical Center's Department of Clinical Research. And additionally, we have Dr. Douglas Neese, and he's a clinical psychologist in private practice, chair of the psychology section at Glendale Adventist Medical Center. And together, this group has put together a project which you're going to learn more about today, although we also want to express our appreciation to Glendale Adventist Medical Center for making this project possible. We have some objectives today, and those include recognizing the physician's role in meeting a patient's spiritual needs, understanding the role of spirituality in coping with stress, learning to describe the benefits of spirituality based on scientific research, learning to recognize spiritual care begins with appropriate patient assessments, and learning to apply spiritual screening tools and techniques. So to start off our story, I have Jack Yu. So will you take it from here, Jack?
Sure. I'm Dr. Jack Yu. I'm a practicing family physician here at Glendale Adventist Medical Center, a faith-based hospital. The story all begins in 2006 when the Spiritual Life Council was formed, and it was formed to answer this question: how do we express and support our tradition of commitment to spiritual values? And its purpose was twofold. Number one, to focus on the spiritual environment here at Glendale Adventist, and number two, how to promote faith-based mission elements. Now, it's important to know what the mission of our hospital is. The mission of our hospital is to share God's love with our community by promoting healing and wellness for the whole person. The council was very concerned about how we can meet patients' spiritual needs. Although both nurses and doctors are involved in that, it was felt that doctors needed more help with this. So, how can we integrate physicians into the mission more effectively was a big concern. So the committee was formed, which consists of the people on your board that you see here, plus another person, 2 physicians, a psychologist, and a chaplain. And you see the picture. The first step that the committee decided was to make an assessment, and this assessment was done through a survey of the medical staff. And this survey was to assess the role that mission, religion, and spirituality played in their practice of medicine at the hospital. And depending upon those results, we're going to make some recommendations. This medical staff at Glendale Adventist Medical Center is quite diverse. Next slide. And reflects the diversity of Los Angeles as a whole, and Glendale particularly. Next slide. The results of the survey show that most of our medical staff that responded felt that religion or spirituality was relevant to their everyday practice of medicine, that they were somewhat familiar with the research linking spirituality and health, and they understood the type of services that their patients could get at the hospital. Lower, however, was they were not as sure of how to address these spiritual and religious issues with their patients. Next slide. This reflects the published research, which shows that 2/3 of all patients want physicians to inquire about religious or spiritual beliefs if they're gravely ill. On the other hand, only 10 to 20% report that their physicians actually did discuss religion or spirituality with them. Surveys of physicians also confirmed that only about 10 to 20% inquired about their patients' spiritual issues. Next slide. So about 1/3 of the survey doctors at our hospital were interested in recent findings in spirituality and health research, how to relate to their patients in respect to their religious and spiritual concerns, and the integrating physicians into mission program we were developing. About 20% were also interested in volunteering in community, national, international disaster relief health projects. Next slide, please. The committee's recommendations included some very traditional means of education like CME, devotionals at CME, library material, having an annual conference, as well as a non-traditional impact video on spirituality and health research, and why it's so important, how to actually do this at the hospital or in your practice. So at this point, David, why don't you roll it? Let's see the video. What's spirituality got to do with it? It was produced with the assistance of our executive producers, many of us on this particular panel, as well as Jeff Blythe, who was instrumental in directing it. Is it starting yet? This video was actually filmed at our hospital, Glendale Adventist Medical Center, and features some of the people on our panel and some actual professional actors and actresses as well. What you'll see is the inside of the hospital and some patients, a particular patient with a particular spiritual need.
Wagner, a 43-year-old female who was admitted to the ED last night complaining of an ulcerated wound on her foot that would not heal.
The patient has a history of past drug and alcohol abuse. I talked to her this morning. She has no primary care physician. She's complaining of intermittent claudication. I got only a faint pedal pulse, and her feet were cold to touch.
Diagnosis?
Peripheral vascular disease. Here's her ankle brachial index, 0.5.
And course of action?
Nothing for now. The patient is hyperglycemic and hypertensive. And until these can be brought under control, she's not a very good candidate for any surgical therapies.
And?
Well, I think it's something personal bothering her. I think it might be spiritual.
What makes you say that?
We talked. She told me she's kind of given up on her religion. She said no when I suggested a chaplain visit her. I even offered to pray with her myself, but she wasn't interested.
I think we should keep the focus on medicine and not get into religion. But assuming that the patient does have some kind of continuing stress, it could exacerbate her hypertension and hyperglycemia.
Okay, let's have a look.
She's really in a mood this morning.
Miss Wagner, I'm Dr. Harmon, and this is our resident team.
Don't know why you people keep talking about surgery. The only reason I came here is just because I need some kind of antibiotic for my foot.
Well, Miss Wagner, there's not going to be any surgery.
Good.
Not until we get the elevated numbers in your blood sugar and your blood pressure under control. Meanwhile, we'll monitor you here until we see some improvement.
Guess I'm not surprised. It's just my luck, the way things have been going lately.
Are you Kate's doctor?
Yes, I'm Dr. Harmon.
I'm Ted, Kate's brother. This is Emily, your sister. How's she doing?
Well, your sister seems to have been through a lot of stress lately.
No kidding. Look, if there was a bad lifestyle choice to be made, Kate can be counted on to make it. I've tried to reconnect with her, we all have, but she's just been so irresponsible.
Kate's had a pretty hard life.
Which she brought on herself.
We've known for years that Kate has struggled to overcome drug and alcohol abuse. I really thought she'd moved past all that.
So she's been in a rehab program.
Oh, yeah. I lost count.
3 times. The last one really seemed to turn her around. What concerns me, though, is her daughter, Sarah. I really don't want to see her head down the same path as her mother.
How old is Sarah?
13, I think.
She's 15, and Sarah thinks she can take care of herself. A trait that seems to run in our family. Maybe if Kate had stayed in the church, I don't know, things could have turned out differently. Maybe she could have counted on them for support.
Well, if Kate decides she's ready to talk with our chaplain at some point, we can arrange that.
Thank you, Doctor.
I can see the patient is clearly affected by a lot of stress, but I thought it was our duty to focus on the underlying medical condition. What's religion got to do with this?
Anything that affects the patient's overall health should be a concern.
You know, these issues are actually the subject of today's noon conference. You should all attend. A psychiatrist friend of mine, Dr. Edward Bernard, is speaking.
Yeah, I think it's called the Science of Spirituality and Health.
Oh, the conference is today at noon. I was planning to go
Right,
to.
you were planning to go.
More and more physicians are beginning to recognize the importance of the correlation between stress and disease. Medicine is faced with the challenge of relating to patients who are struggling to deal with chronic stressful situations that can feel overwhelming. As you can see, recent research has shown the benefits of spirituality to help mitigate that stress. Studies reported by Dr. Harold Koenig of Duke University have shown that better health outcomes are consistently found among those who are actively involved in the religious faith. Any questions so far? Yes.
You're not proposing we actually prescribe religion to our patients?
No, of course not. No, the real question is how to determine which patients employ spirituality to help them cope with life stresses. Those with better coping skills experienced reduced stress levels. And that's the underlying key to a range of improved health outcomes. But there's a lot of variations within individuals. And that's why I recommend that you administer a brief spiritual history. Does that answer your question?
If I understand, you're saying that just being religious promotes good health.
What I'm saying is that a number of research studies have demonstrated a broad correlation between using religion to cope with stress and better health. Now, that having been said, my own research looks to find more causal mechanisms because they help explain why addressing spiritual issues could be more directly useful to patient care. We know stress hormones like cortisol can create a toxic physiological effect that can exacerbate psychological trauma. But I would also like to point out the significance of what I call spiritual struggles, such as patients experiencing anger against God for their current condition. I have found that for patients working through these kinds of spiritual issues, the process leads not only to a reduced risk of adverse health outcomes, but also to a deeper faith.
Dr. Bernard, if you don't mind, I'd like to have a look at one of those spiritual history surveys.
Well, sure. Let's go in the lounge. I'll get one for you. You're going to need one, too.
Oh, me? Not really. I'm not comfortable asking my patients about their religious history.
You ever ask a patient for a sexual history?
Of course.
Well, once it was considered too personal, off limits. Now it's an accepted practice, right?
Sure, because it's directly related to the patient's health.
Exactly. And taking a spiritual history can be just as beneficial in its own way. Here's what we use for charting spiritual care at this hospital.
Medical school just didn't teach us how to deal with spiritual questions.
But that's no longer the case. There has been so much research. Most medical schools are now addressing this very topic. Anyone who has not received that kind of training can always call on a chaplain or a pastoral counselor. I mean, you wouldn't hesitate to recommend a patient consult with a specialist in, say, cardiology, if that's what they needed.
But how far should we take this? I mean, should a physician actually pray with a patient?
Of course, religion shouldn't be imposed on anyone. But I suppose if the patient initiated the request, well, in any case, it's an individual call by the physician.
Oh, that's it?
Sure. Just some simple questions to assess how a patient relies on spirituality to help deal with life challenges.
Or not.
Right, or not. You see, taking a spiritual history gives you a bigger picture of a patient's health. Medical schools should be teaching that you have permission to use this valuable tool.
Edward?
Oh, what, Lee? You see, healing is not just physical, separated from the rest of the patient's life. I encourage doctors to address the emotional and spiritual aspects as well.
Dr. Bernard and I don't always agree on this. I prefer to think of it as whole person healing, not 3 distinct disciplines.
Yeah, and that's why he thinks I charge my patients 3 times as much.
Here's the report that you... Yeah, thank you. Come with me. Dr. Neese says Kate Wagner's profile is within normal limits, and he's ruled out any indication of psychopathology. I want to see her again.
Dr. Harmon, not more tests.
Your elevated blood sugar and blood pressure continue to delay the surgery that you need. I recognize something is causing you stress, and it's affecting your health. Kate, I need to know what's going on. Why are you in the hospital?
I've told you people, the sore on my foot was killing me. I just came here to deal with the pain.
No, Kate. I need to know what's troubling you.
For one thing, my daughter's home alone and there's no one to take care of her.
Where is Sarah's father?
Good question. He's long gone.
That must be difficult for you, raising her yourself.
Didn't help. I've been in and out of rehab a few times. Finally got a decent paying job. Just waitress work, 2 shifts. Things were starting to look up for me. Well, I don't get any health insurance, right? My boss doesn't even know I'm in the hospital right now. And next week, my rent is due.
You must feel overwhelmed.
When I was 12 years old, my mom threw my dad out of the house because he was drinking. Up till then, I was Daddy's little girl, A couple years later, he died. No money. No family. I always blame my mom. He died alone, It was her fault.
That must be a terrible burden.
It feels like this is punishment for all the terrible choices I made in my life, Sometimes I think that's why this happened, because I deserve it.
You've been through so much.
Doctor, will you pray for me?
Lord, right now Kate is worried about her daughter Sarah, about keeping her job and paying her bills. After years of frustration, just as things were coming together for her, another disappointment. It's at times like these that we can be thankful that there's a power in the universe that loves and cares for us. Lord, we put our faith and our trust in you.
Thank you, Doctor. Please. What's going to happen to me?
After surgery, we'll find resources to help you continue to put your life back together. I want to have a chaplain discuss ways for you to embrace life, if you'd like that.
Yes.
Wow. What a turnaround.
Yes, Kate has moved from a place of stress to a place of rest and inner calm. In situations like this, stress levels can change very quickly as the brain releases beta endorphins instead of producing corticosteroids. But it's not all blood chemistry, no matter what Dr. Bernard says.
So tell me this. Why didn't you do a spiritual assessment of the patient before praying with her?
What makes you think I didn't?
Excuse me, nurse. Hi. Any updates on Kate?
Yeah, Kate's blood work is looking much better now. Her surgeon will be in touch with you to schedule a procedure very soon.
Wonderful news. Thank you.
Mom?
Can you believe it? I got a phone call from Kate. She asked me to come. Wait, did you tell her to call me?
What? No, Mom, I don't know anything about it.
Honest, Mom? She must have called you on her own.
I'm sorry. It's my Kate. I missed you too.
Mom?
Next patient, Mr. Markham. Who would be willing to take a spiritual history?
Sure, I'll give it a try.
Well, thank you for watching that video, and I certainly hope that you enjoyed watching it as much as those of us on the team did in producing and creating it. I do want to reiterate that we had some specific objectives in the making of this video, and being film stars was not one of those objectives, although I have to compliment my colleague, Dr. Doug Nees, who actually had a speaking role in that video, and Jack and I were not quite so fortunate. I think our role was confined to being small-time extras. But nonetheless, we really had set out to try to help people understand the role of spirituality in coping with stress, as you could see, hopefully. Also to recognize that spiritual care begins with an appropriate patient assessment, and as well to apply properly developed and validated spiritual screening tools and techniques. And a little bit later in our presentation, we will share with you some of those tools and techniques specifically. But perhaps more than anything, the most challenging goal that we had set ourselves with the making of this video was to just help healthcare providers, to recognize that there are forms of spiritual intervention that can actually lead to objective, proven, improved health outcomes. And as you saw from data presented earlier by Jack, there is some awareness of the research linking spirituality and better health, but certainly that awareness and that knowledge is not as widespread as perhaps it could be. So let me just go over with you for a few moments just a small sampling of the research that is out there in the medical literature that links spirituality and health on a scientific level. Here, for example, on the slide is a reference to a study, a very large study actually, of over 5,000 people conducted over 28 years prospectively, with the amazing finding that people who attended regular weekly religious services actually had a decreased chance of dying during the follow-up period when compared to people who did not regularly attend weekly religious services, and that reduced risk of dying was 23% over the follow-up period, a dramatic finding from a public health perspective. In fact, so significant is it that the magnitude of the effect is the same as if you were comparing two groups of women, one group of which smoked cigarettes and the other who did not. So we all know that there's a proven effect, a beneficial effect of not smoking, but can you believe that attending weekly religious services has an effect of this magnitude? And the same findings were in fact replicated in a similar study of 4,000 adults followed over 6 years, and again the effect was very strong and was most pronounced in women. Next slide, please. So can the claim actually be made that religious people live longer? Well, there was a survey of 20,000 American subjects which found that whites, Caucasians who attended religious services, regularly lived an average of 7 years longer than those who did not. That's a big enough effect as it is. But in African American populations, where the same question was asked, actually those who attended religious services regularly lived an average of 14 years longer than those who did not, after controlling for other covariate factors and other explanatory factors. And I do want to emphasize that these studies are published studies in the conventional medical literature. They are not studies that focused on any one single denomination or religious belief system, but in fact examined religious service attendance across many different denominations and faith groups. And the question might be asked here, is this causal, this relationship? That is there something in the attendance of religious services intrinsically that causes people to experience better health or to live longer? Or is there simply a strong association such that people who attend church or religious services also engage in other behaviors that promote good health? And that's a fair question, and we'll talk a little bit about that as well. Next slide, please. Now, you could also ask how and why is it that there is in fact a relationship between attending religious services or participating in spiritual practices and experiencing better health? And there are a number of very good scientific hypotheses. For example, it's well known that stress leads to the release of inflammatory mediators. There are a whole cascade of these. One of them is called interleukin-6, or IL-6. And it's also known that the release of IL-6 promotes the release of cortisol. And there's additional knowledge in the literature, and Dr. Harold Koenig, who's an internationally known expert in the link between religion and good health, who's a professor at Duke University and was a consultant on our project, has published some reviews of the literature in which he shows that religious services may decrease stress. And it's also known from data, part of which was generated here at Glendale Adventist, that regular religious service attendance is associated with a decrease in other inflammatory markers, such as high sensitivity C-reactive protein, and that results in primary cardiovascular disease symptoms being relieved. Next slide, please. So certainly there are some plausible scientific mechanisms for how this relationship might come about. Here is a prospective study relating religious attendance and the levels of IL-6, as we mentioned, showing that in over 500 adults, frequent attendance of religious services reduced the risk of dying in the 6-year follow-up period by 78% compared with non-attendance. And this finding seemed to be mediated, in fact, by decreased levels in the blood of this inflammatory mediator called IL-6. And at this point, it's worth emphasizing, what if we had a medication? What if we had a procedure, a simple procedure or an intervention, a medical treatment that resulted in 78% improvement in mortality in a given disease group, would we be promoting it? Would we be selling that treatment? And this is an intervention or a treatment that really costs nothing. Next slide, please. Now, there are a number of factors that, again, can be brought forward that can be shown to, that can relate spirituality to better health from an experiential and psychological perspective. So we know, for example, that engagement in spiritual practices or religious services or being part of a religious community or a faith-based community can result in reduced stress. People can actually also choose to practice healthier behaviors as a result of association with their faith community. There's also the possibility that better compliance with medical treatments or with prescribed therapy might be going on, and all of these leading to possible improved health outcomes. So if we examine these one by one just briefly, engagement in spiritual practices, involvement in religious and faith-based communities clearly can result in reduced stress due perhaps to the music, the socialization, the active practice of love and forgiveness in a group setting. And it's also been shown by Koenig and others that people are empowered to change their lives or their attitudes for the better as a result of engaging in these practices, and thereby exhibiting better coping skills. Now, there's some very, very definite health-related behaviors that seem to really be impacted by people who are engaged in spiritual practices or in religious communities. For example, literature is very clear that people are more likely to stop smoking. They're engaged in spirituality or in religious belief circles. They are more likely to do simple things like wearing seat belts that have a big impact on health and on injury. They sleep better. It's also been shown that folks who are religiously active exercise more, although ironically, at least one study has shown that they also struggle more with weight problems. I don't know if that's the result of tasty church potlucks or what that relationship is caused by. But it's also more likely that people in these communities have an increased rate of being screened for diseases, engaging in preventive care, having a primary care physician that they regularly go to, and also suffering from less substance abuse problems. And then lastly, it's also the case that once disease is established in people who are religiously active or active in their faith-based community, is that they simply comply more faithfully with prescribed medical treatments or medical therapy. For example, post-heart transplant patients stick with their medical regimen more faithfully, as shown by Harris in 1995. Hypertensive patients take their blood pressure medications more compliantly, and as I mentioned, they're also more likely to have a regular medical provider. Just as a further teaser for, and this is, like I said, just the tip of the iceberg of medical literature available out there, but Koenig in 2001 showed that in a meta-analysis that numerous studies showed a lower mortality from cancer, from heart disease, from stroke. There were fewer cardiac complications after surgery, and interestingly enough, those with established Alzheimer's disease tended to have a slower progression of their chronic disease if they were religiously active or engaged in spiritual practices. And patients with HIV showed very, very objective, hard markers of improvement in the form of higher CD4 counts, lower viral loads, and slower disease progression in their HIV if they were religiously active. Now, this is all impressive data, but I think a fair question again is to ask, what do we do with this? Those of us that are clinicians and practitioners, how do we translate the fact that there's a relationship between these behaviors and better health to the care of our patient in front of us in the exam room or at the bedside? And what do we do with that? And I think this is where my colleague Doug Meese has some interesting things to say.
Thank you, Dennis. The question then is, why do we assess for spiritual care? And I hope that after listening to the review of the literature by Dennis, it seems very obvious. We really want to acknowledge the whole person in every healthcare encounter. We want to be able to identify the relevant resources that are going to have an impact on the health and well-being of each patient. To be sensitive to the given patient's spiritual beliefs and needs, it's important to know who they are, what their background is about. But the bottom line is to improve health outcomes. That's really why we need to introduce this to as many physicians as possible. This is a key component to healthcare. We can have the next slide, please. I recognize that the solution and the process is going to be different whether you're dealing on an inpatient basis or an outpatient basis. But we're going to go over 3 levels of assessment that will give you an overview, and then we're going to move into the particulars of the tools on how you take a spiritual history. The first has to do with a spiritual screening, a triage. This is the introductory part for the physician. It's quicker. It's a determination of whether the patient is in a spiritual crisis at that point. And if so, an immediate referral to a spiritual care provider, a pastoral counselor, a professional chaplain, or somebody who has spiritual authority in that patient's world. The second, and I should mention that the first 2 are open to all healthcare providers. The third is going to be something that is for the clergy. But the second one is the spiritual history taking. This is a more comprehensive approach. It's designed to address or identify more specifically the patient's spiritual needs, the resources that are available to them, their belief system, and what the components or factors are that may affect healthcare decision making. Now, the third level, the spiritual assessment, as I mentioned before, is really designed for the clergy. Of course, it's going to be a lot easier if you're working in a medical center to request that the chaplain come by and they would participate in this. It can be more complex on an outpatient basis just from the medical office, but that's why it's also important for physicians to acquire additional resources in the community for this. The spiritual assessment is a more extensive process that involves an active listening process to the patient. It's, again, as we say, done by the spiritual care professional, and it's going to involve a spiritual care plan with expected outcomes. Let's move into then the specifics on the spiritual history tools. There are a lot of tools that are available. We have on this slide 3 that are listed. FICA, that's should be easy for most physicians to remember. HOPE, again, that's a good term, in spirit. These are not the only ones, but I would pause and highlight that these are very good ones. Dennis and I were talking recently about how even in aeronautics, trained pilots still have their checklist, and even though they maybe have 10,000 hours flying, they still operate with a checklist. And so these checklists are very, very important, particularly when learning how to do these spiritual histories. You walk through the checklist. As you get experience with that, you adapt it to your own personality. You adjust it to the practice, and you always want to make it specific to the patient. There's another one that we don't have listed here. It's approved by the American College of Physicians, and it's known as the ACP Spiritual History, and it has 4 simple questions. Those questions are, is faith, and we can substitute religion or spirituality instead of faith, but is faith important to you in this illness? So it's specific to the patient and their particular medical concerns at the time. The second question would be, has faith been important to you at other times in your life? The third, do you have someone to talk to about religious or spiritual matters? And the fourth, would you like to explore religious matters with someone? So these are 3 or 4 different approaches. There are more in the literature. It's useful to get a sense of what's going to be most comfortable for you. But don't be afraid because it's a checklist. Utilize the checklist in this way. It's powerful. Next slide, please. So we've looked at the why, and we've looked a little bit at the how. Let's take a look at what is it we're to notice. What do we look for? Of course, we're looking for new resources, but we also want to take a look at the neglected resources. But a third category has to do with the negative spirituality. Sometimes it's known as toxic faith. The reason we want to look for these is because these lead to adverse health outcomes. These would include beliefs that are extreme. When a patient who's in a crisis has a belief that God is punishing them with this illness, that God is rejecting of them, they might experience a sense of hostility towards God. When they have a sense that they are being rejected, that they have been abandoned, these are key problems. And so it's important as a physician that you be aware of the patient's mindset with this so that you can refer them to a professional chaplain with that. Next slide, please. We're going to look at 2 key mechanisms under these psychological perspectives that are kind of aims of this caregiving. So we've looked at the connection between the research on spirituality and religious practices affecting healthcare. We've taken a look at the why we do this, the how. We're looking oftentimes towards 2 areas. A relaxation response, and this became very well researched in the middle 70s. A physical state of deep relaxation that changes the physical and emotional responses to stress. These stress reactions are what can be particularly dangerous or change things about the healthcare outcomes. We have a list of the acute effects of relaxation that is very important. These are the physiological means whereby relaxation will be of great assistance. Next slide, please. The second area occurs with the perceptual shift. When the patient's no longer looking at the stressor as a threat. Instead, there's been a shift. In the movie we saw where there was a transition from stress to rest. New terms might emerge. The concept of hope. Maybe there is potential hope ahead. Faith reframing. Next slide, please. We want to look and be aware that the caring can yield the following. It can get this cathartic response when we reflect the patient's emotional expression, their particular concerns, the uncertainty that they're going through, or their frustration. And then as providers, we want to assess the best way to facilitate a constructive perceptual shift. Now, in the movie, we saw Kate's perceptual shift that occurred as a result of an empathic prayer. Next slide, please. An empathic prayer is going to involve 3 key elements. We saw the doctor listen empathically. He was encouraging the expression of feelings, acknowledging Kate's difficulties with providing for herself financially, for her daughter, etc. When a patient seems stuck, when they're unable to have a sense that there is hope, this prayer can reflect the frustration. There's permission for the prayer to reflect affect of the patient. And when it can be conducted in a way that makes it personal, we saw in the movie where he says, in which we hope. You can make that first person, in which I hope. This is a connection process with the patient. Next slide, please. The empathic prayer effects. It's important that through this process that the patient is feeling heard, It's not just about problem solving, it's identifying and listening. That the patient feel respected as a whole person, not just as a set of symptoms. That the patient can find gratitude and feel grateful as they are listened to, and there's this empathic connection. Anytime we have this compassion, this is involving true care. When we can go for the final outcome of relaxation and an inner calm, this becomes particularly important as well. We are going to be moving to our next phase in this presentation with a question and answer period. And if you will ask or formulate your questions by entering them into the chat box, that would be most useful for the panel to be able to address them. So at this time, if there are questions that are being formulated that want to be addressed to a given member, that would be appropriate. Bruce, you're going to transition us some more?
Well, I hope that you've all enjoyed our discussion today. I know that many of the things that we've been discussing in this presentation are, in fact, on the edge of where healthcare is going. I mean, we really are learning that spiritual considerations are very important in the ultimate healthcare outcome associated with patients, and we're learning more about how it is that we can address those effectively in strategies. So we've seen some of that in the video. I mean, we saw an example of how a physician interacting with a patient resulted in an outcome that dramatically reduced the patient's sense of stress. And ultimately, that's where we're headed. I mean, the research clearly indicates that stress is a big bugaboo. I mean, it is a real serious concern as a predictor for patient outcomes. And we want to do whatever we can to avoid it. Spirituality, fortunately, is one of those things that can help us to avoid it. Okay, let's see what we have for questions. Okay, so we're waiting for you to direct your questions to us. So, for some of you, this will be novel. Others of you recognize intuitively that this makes sense. That is to say, we've all known, in the backs of our mind all along, that the level of stress that people experience is a big influence in affecting their health outcomes. And we've struggled at different points to figure out ways that we can, in fact, address that. We struggled with ways that we can address stress as an influence on people's health care. So the question we have is, have these principles been applied at our hospital? And the answer is yes. Actually, we train our chaplains here to recognize when it is they're seeing a patient who's experiencing stress. And we specifically ask our chaplains to recognize when it is they're seeing a patient who's experiencing a crisis of faith. That is to say, something's going on in their lives that's really causing them a lot of stress, and it has to do with their religious beliefs. And then to address that in some of the ways that we've discussed here, to focus more of their effort and attention on that patient's needs and help to facilitate the kind of perceptual shifts. And essentially the perceptual shift that we're looking for is to begin to trust that there is love and care available to them. That can come from a lot of different directions, but it's certainly modeled in the example of the chaplain, him or herself.
We have another question. What beneficial result have you seen in your particular institution? And how do I ask my doctor to address my spiritual issues?
Well, I'll jump in with that first. I can think of a number of examples, and it takes a while to tell the stories, but a number of examples where the kinds of reduction in stress that we've seen modeled in the video, in fact, have occurred for patients. And we're reading between the lines when we then project that means that the lowered level of blood pressure and the lower blood sugar and the other kinds of health correlates that correspond with that, well, then assist with a better health outcome. We can't necessarily follow that for every single patient, but the studies in general indicate that that's the case. Second part of the question?
How do I ask my doctor to address my spiritual issues?
Yes.
That's a good one. That's a good one. I might want to take a stab at that one. And I would say that some of the data we presented today should be helpful to you, and particularly the numbers that Jack, you shared with us, saying that more and more research is available. In fact, physicians are aware of something like a third to a half of physicians, perhaps more, were aware that there are published studies linking better health outcomes with spiritual practices. And if you as a patient are with your physician and you simply tell him or her that you've come across this research, or you read a news article, or you saw this program in which data was presented linking these two, that should be a real conversation starter. And you might want to simply volunteer the fact that you really would like to talk about how you can use your own faith background or your religious practices in ways to improve your health. And I think that there's no better way to bond with your physician and to, in fact, share on a more intimate, personal level some things about you that cannot help but be helpful to that doctor in taking care of you.
I would also add in that this is really about permission, and we want to give patients permission and doctors permission. It's not unusual that patients educate their doctors, maybe not about all of the scientific components of medicine, but certainly they have to educate them about their own needs. And so when we focus on permission, it might make it a little bit easier.
Another question. What spiritual needs does an atheist have? For example, Richard Dawkins.
I guess we'd have to ask Richard Dawkins' doctor. But this is a great time to say that in the research that we've seen, oftentimes religion and spirituality, the definition of those terms is very challenging. And the researchers themselves in the field sometimes go back and forth as to what constitutes religion for one person or one group, or what is spirituality. And some of the best definitions I've seen, and there are many out there, and I'd love to hear my panelists' opinion on this, but some of the best definitions I've seen include a concern with ultimate matters, or a sense of connection with what is ultimately or profoundly meaningful to me. That is, in fact, spirituality to me, or even religion to me. And so I would tend to guess that even an atheist, even Richard Dawkins or someone else, has, in fact, things in his or her life that are of ultimate, profound, deep concern or deeply meaningful to that person. And if they're engaged in practices around those deeply meaningful elements in their life, to me, I think that's helpful to help improve their health.
Let me just comment on that. Even atheists need a purpose in their life, and the definition of spirituality does include that. We had, for example, an atheist with an alcohol and drug problem who had difficulty with the 12-step Alcoholics Anonymous, step 1 about having a higher power, but yet she was able to use some of those principles that are in the Alcoholics Anonymous plan. Forgiveness, telling other people what they've done, redemption, and then going back and using what they've learned to tell others. All some examples of some spiritual principles. And in fact, we actually train our residents here at Glendale Adventist Medical Center that they should talk or seek to find out about a patient's spiritual activity, much as they do about sexual activity. So in social history, where do you live? Are you married? Do you have children? What do you do? Do you have a faith that's important to you? And for those who are, especially that come for alcohol and drug treatment, it's been found that those who actually have a real spirituality, that this is really important in decreasing the chance of going back on alcohol and drugs.
It's also important to recognize that this is not a time of, say, Bible study or of teaching them about faith. It's inquiring, what is their faith? What is it that gives you purpose and meaning? What of those components is important to you at this time of your illness? What has worked for you before? So it's not telling them what to believe. It's inquiring, about what's important to them. So I think that makes a big difference too. This is not to pressure a patient, it's to open them up, it's to relax them, it's to help them look at resources that perhaps they've neglected. And many times when patients are approached in that way, they open up and they say, well, as a kid, this was something that was meaningful, but I left because of this, and there's a barrier. And that dialogue then becomes very important in the process of spirituality.
Yeah. We want to remember that our purpose here really is to benefit health. I mean, we're really looking at lowering stress and increasing that inner calm and peace that a patient feels, because their bio, correlates are all going to improve when that happens, and that's going to make it easier for the physician and increase the probability of a better health outcome. And that's what the team is really working together to produce.
We have another question from Dr. John Barrett. Have you experienced any adverse effects to the initial spiritual assessment or triage?
I don't think so. Most people will respond well if they're respected. And we want to make sure that in whatever we do here, in the way we deliver the triage, it's very respectful of the patient. Our intention is to be helpful. And if a patient indicates immediately some strong reaction, then we're simply going to move on to the next thing. We're not intending to force an issue with any patient. Personally as a chaplain, I would be alert to those kinds of patients that do have strong reactions, because there is a possibility that they may in fact be more at risk of a negative health outcome than others would be. But if a patient doesn't want to talk about spirituality or the significance of religion in their life, then by all means we're certainly not going to impose that.
Okay. Another question. How would your facility help Kate find new resources to help outside of the hospital?
Maybe I can address that. That's very good and very challenging. No easy answers there, but we do have, like every acute care hospital does, a social work department where master's degree prepared social workers do have expertise in community resources, be they shelters for those who are homeless, be they foundations or nonprofit agencies that help women who are battered or people who are victims of abuse of some sort, or simply patients who are struggling with substance abuse or alcoholism, as in the movie. So resources are not universally available to fit the need, but they are out there, and there are always things that we can do. In fact, there's a large proportion of our patients who, like Kate, do not have health insurance, and who, when they leave the hospital, certainly are still struggling with chronic illnesses, and in almost every case we are at least able to point them towards or to connect them towards some sort of help.
What has the reception been like in medical institutions to your program and video?
I don't know that we can address what the reception has been in all the different places where it's been seen, but where we have presented it, it's been received well. I would say this, however, that the topic in general, just an indication of the receptivity to the topic in general, is indicated by the increased number of courses that are currently being taught in medical schools. If you go back 15 or 20 years ago, there was a time when only 3 medical schools taught courses related to spirituality and health. And today almost all of them do. There are only a few, perhaps, that don't. So the receptivity, I think, is there, acknowledging this connection and its importance in patient care.
We also designed this particular intervention as an impact video, where we want people to respond to it, to stimulate thought, not to give them a specific pattern or solution, but tools. But the movie was an impact video, and so we hope that people do have responses. Most of the ones that I have heard have been positive. People have received it well. We maybe just have a selective audience on that.
Yeah. I'd add to that too that when we distribute the video to another medical school or institution, there's a manual that comes with it, actually a leader's guide, and then there's a participant manual that has a lot of the research and a lot of the detail that you may have heard described in our comments after the video. Those are included in the manual. So they get a lot more than just the video. So that's just an acknowledgement. It is an impact video itself, but it's accompanied by a great deal of additional information that helps the participants in various programs where this is featured to relate more effectively.
Another question, what resources, books, videos, audios can you recommend for those going through trying health conditions?
That's a broad question. I think we have resources again in the manual.
Yeah, you know, for patients themselves, I'd say certainly do the Google search. That's the first place I'd start. I can recall doing the Google search on spirituality and health years ago when there were only a few resources available. Now you'll find hundreds of thousands of potential pages addressing this topic. So I'd start there, and there's a lot of them. Certainly Dr. Harold Koenig's work is valuable both to the individual patient as well as to the prospective researcher or the clinical provider. Lots of information there. You can check out our website at www.wholepersonresources.com or info@wholepersonresources.com, and we'll put up, oh, you have that slide up in front of you as well. Certainly, you're welcome to contact us directly. You have our phone number there if you're interested in the video or in following up with some of these questions. But Google's a great place to start. There's lots of resources out there, and there's a lot of this research that's being conducted with information that's being published. Okay, so let's hand this back to David, and let's thank all of you for attending here with us, and thank you, David, for assisting. Also, in the process, I want to thank Dr. Sally Shaw, who has been behind the scenes here helping us with our project as well. So, David?
Well, thank you so much, gentlemen and lady Sally. This has been very, very, very enlightening. So we really appreciate you taking the time to do this, and we believe that this video and this presentation will be shown around the world, because God knows hospitals and patients and doctors all need to have this kind of information. At least, as you said, it's an impact video. Doesn't give you all the information, but it shows that this is important and this needs to be done. So we will do our possible best to make sure that as many people as possible have access to this. Thank you folks again for joining us. They did mention Dr. Koenig has resources. I've forgotten what his website is, but he does have a DVD that he did with us, and that was like a 2-hour-long DVD, so you may not be able to go through it all in one sitting, but he really goes through each step of the whole. He includes the spiritual history, but he also gives lots of research, and Dr. Dennis, to mention a couple of those resources as well. So that will be available on our site. The video for this presentation will be available in a couple of days, and we'll let you know, those of you who have registered and attended, we'll let you know how to access it in the near future. And we are really hoping that we can have some more of these discussions in the future, because again, this is very, very important. All right, let me just make sure. Okay, Sally, if you're going to call Sally, she'll be the number that she put up. That's the way you access her office, and then she'll be helping to take your orders for the program, the DVD and the program. And I believe that there are CEU credits attached to going through the program. If you're going to call her, be sure to mention that you heard about us through Building Strength webinars, or you heard about them through Building Strength webinars, and there will be a discount given to you just because you're calling or because you use our name. So be sure to do that. I believe it's at least 10% discount just for using our name. What else do we need to talk about? think that pretty much covers it. Sally, is there anything else? You want to send me a quick chat to make sure I've covered everything we discussed? And by the way, I believe above the slides, above my video is a link to our website. Above the slides, it should be a link to Whole Person's Resources website. So you can just click there and I'll take you to their site and you can get some more information. Sally, I'll wait for a few more seconds if you need to send me any comment before we wrap up for the evening or for the day. Folks, there will be some interesting presentations next week on autism, Asperger's syndrome, and some interesting approaches to dealing with them. It's called the Erland method, and she's in Southern California as well. Okay, great. Sally says no comments. Again, thank you, folks. Thank you, doctors. Dennis and Doug and Jack, and of course Bruce and Sally. Thank you so much for doing this, and God bless. We'll see you soon. Take care.